Good evening, everyone.
Very good evening, ma'am.
Good evening.
Requesting everyone to put on their videos so that we can
Good evening,
connect. Quickly put on your videos.
Good evening, ma'am.
Good evening. Waiting for everyone to put on their videos. How are you all doing?
Thank you. We are fine.
Okay.
Oh, good
Okay,
evening.
let's start with a brief introduction. Yeah. So my name is Sonali and I'm a psychologist and a counselor and I'm RCI certified and I have varied experience of working with children as well as adults. So today we are here to discuss something about child psychology, primarily discussing about the challenging behaviors. So I would love to learn from you all as well. So it should not be a one way of learning. I feel that learning is something that happens when we are all together. So together, ICS has brought us together in this platform so that we learn from each other. Okay, so I would request everyone to put on their videos, be participative in the entire session, and I hope it will be a great learning experience for you all. So, who wants to start with their introduction? I've given my brief introduction. So, you have to tell your name, what you do, and what are you looking for. All right. So, let's.
Ma'am, good evening. Good evening, everyone. This is
Okay.
Dr. M.G. Chandrasekhar, residing in Nellore from Andhra Pradesh. I am a psychotherapist and counselor. I am working in a de-addiction center.
Okay. Okay.
Thank you
Thank
very
you,
much.
sir. Yes, next. Let's quickly do it and not waste time in this, not waste much time, but I would love to know you all. So let's do a quick introduction. Yes, quickly unmute and speak up.
Hello, I'm Radhika. I'm a school counselor. I just wanted to know more about child psychology, so I joined the course.
Okay, sure, ma'am. Yes, next.
Hello everyone, my name is Deepthi. I'm pursuing psychology, but I've been practicing under a psychiatrist. And the child psychology is my special area of interest and very interesting because I believe that they are next generation. So whatever we see now, the crimes or whatever it is, it's just because they have not been treated or addressed at their proper areas and proper age. So I feel that is the major part we can help them, and especially in the mental health. That is a very interesting and creative area of work where we can contribute and learn as well. And it's never ending in this field to learn. So that brings me here.
Okay, thank you so much. Hoping you have a great learning experience today. Yes, next.
Hello, I am Dr. Pushpa Dayal from Porbandar, Gujarat. Basically, I'm an eye surgeon, but I have worked a lot with children. I wanted to join this course. I did my course with ICS just 2 months back, and they have sent me the certificate, and I like that course very much. So I joined.
All right, all right. Yes, next. Quickly unmute and speak up. Anyone can go ahead. It's not
Hi,
like
can
we
you
are not
hear
doing
me?
in any order. Yes, yes, I can hear
Yeah.
you.
Yeah. Hi. So my name is Abhilasha Thakur, and I am clinical psychologist certified, RCI certified clinical psychologist. And currently, I'm working in Tata Trust Nagpur, and it's a initiative district mental health program So, and I do want to do this course because like usually I go in community mental health community areas, so where children with ID or autism are very much underdiagnosed. So like I want to give them a very less benefit which they can give at a rural level, because their education is not that much given importance, but at least therapy can help them with medications. And that's why I want to pursue this course, and I'm very much interested in child psychology as well.
Yes, next. Kalyani, are you speaking? I can't hear you. You're not audible. Can't hear you. Just try and fix up your mic. Till then, someone else can start and then you can come back again. Yeah. Yes.
Hi, I'm Kishita here. I'm sorry, there is a severe bandwidth problem and I'm unable to start the video. Okay, so I am a clinical psychologist. I've been working for 11 years now and I'm from Mumbai. And it's just like a refresher course. So just something that I would learn and refresh my skills here. So yeah, that's me.
Yes. Next. No one wants to speak up. I can see so many people are there and no one wants to speak up. Why is it so? Yes, Anjali, I think you are speaking something.
Yeah, hello. Good morning. Good evening.
Good
My name is
evening.
Anjali Saxena. Right now, I am pursuing graduation in psychology, and I want to become a clinical psychologist. Thank you.
Okay, thank you.
Hi, my name is Priti, and I'm also an undergraduate student in second year.
Okay. Yes, next.
गुड इवनिंग टू ऑल. गुड इवनिंग मैम. मेरा नाम जितेंद्र पासवान है और मैं एमए सेकेंड ईयर में हूँ और मैं भी लर्नर में हूँ. इग्नू से मेरा कॉलेज चल रहा है जो एमए क्लिनिकल में चल रहा है और मैं एज ए स्पेशल एजुकेटर जॉब करता हूँ मुंबई में और रहने वाला झारखंड का हूँ.
Okay, thank you. Yes, next.
Good evening, ma'am.
Good evening.
Good evening to all of you. My name is Samar and I have done my master's in clinical psychology and I have a passion regarding subjective psychology because we were having being on the psychology and looking the psychology subject as the theoretical aspect, and I'm more passionate about the practical aspect, so I just want to learn more and more. Thank you.
Okay, thank you. Yes, next.
Hi, ma'am. Good evening. Ashish this side.
Good evening.
I am parent of a 5 years old kid, and I joined this seminar to learn how to handle kids' aggressiveness and their demands.
Okay.
In this era, actually, kids are very much demanding and aggressive. So I would like to learn something valuable.
Okay, sure.
Thank you.
Yes, next. Dr. Sandeep, I think you've unmuted. Are you speaking up? Anand?
Not really audible. Voice is audible, but some.
Yes, yes. You're audible, sir. You can speak up. All those who are not speaking at the moment, please requesting you to put yourself on mute. Otherwise, it's disturbing for others. For those who are speaking, please unmute and speak up. And I want everyone to switch on their videos. There is no option of not switching on the videos. This seminar, sir has already written in the group, like in the chat box. So please have a look at this. But it's mandatory to put on your videos. Yes, who wants to give the introduction? Yes, Nirmal.
Hi, ma'am. I hope that I'm audible to you.
Yes, yes, you are.
Hi, everybody. I'm Nirmal Kara. So currently, I'm pursuing applied psychology. I would be like graduating by the end of this month. So that's what bring me here is like exploring new fields and knowing about psychology in different branches, how it is outflowing. Yeah.
All right. Thank you. Yes, next. How about others? Quickly speak up.
Yes, hello.
Hello, good evening.
Good evening to you. This is Daniel Obote. I'm calling in from, I'm joining in from Uganda. Lira. Yes, I'm a student at Uganda Matters University, pursuing a master's in mental health counseling psychology. So I'm delighted to join the rest of the team. Thank you.
Sure, thank you.
Hello, am I audible, ma'am, now?
Yes, 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 you're audible now.
Yeah, hello everyone. My name is Kalyani and I'm from Pune, Maharashtra. I'm also working as a school counselor in Pune. Yeah, and yeah, I would like to know about more child psychology. How can I implement in practically? So because of that, I have. Thank you.
Thank you. Yes, who's next? Aishwarya, I think you unmuted.
Yes, ma'am.
Yeah.
I'm Aishwarya here. Currently, I'm pursuing my master's in
Put on your
psychology.
video.
Hello.
Yeah, put on your video also, no?
Ma'am, I have work and good. So,
Okay.
like,
Okay, speak up.
also cutting that. Yeah. So currently, I'm pursuing my master's in psychology, and like I have utmost interest in child psychology. That's why I've joined this.
Okay. Thank you.
Thank you.
Yes. Who's left?
Hello.
Yes.
Am I audible? Yeah. Good
Yes,
evening.
ma'am. Yes, good evening.
This is Mahalakshmi. I'm from Bangalore. I'm working as a school counselor. So I'm working with children of varied ages. I'm more interested to learn new things in this area. Thank you.
Thank you. Yes, who's going next?
Hello, am I audible?
Yeah, yes, you're audible.
Good evening to one and all present. I am Jeenie Ade. I'm from Kolkata, West Bengal, and I'm currently pursuing my bachelor's degree in psychology, and I'm in my second year. And I wanted to know more about child psychology so that it helps me to decide in what field I would want to specialize when I do my master's. Hence, I joined this workshop.
Okay, okay. Yes, next. Who is left to speak up?
Hello.
Yeah.
Am I audible, ma'am?
Yes, yes, you're audible.
Yeah, I'm so sorry I won't be able to actually, start the video just because I'm traveling and bandwidth is very low. And I am Dr. Garima. I am from Udaipur. I stay at Delhi, currently working as an HR manager. And I've want to pursue child psychology courses because I want to learn about child disorders and want to apply it practically over this. So that's the reason I'm attending this webinar.
Okay, thank you.
Okay. Thank you.
Yes. Who's left now? Those who want to speak up. Quickly tell me.
Hi, everyone.
Hmm.
Very good evening, ma'am.
Good evening.
I'm so happy to see you again.
Same here,
Uh,
Swati.
so I'm a student. I'm pursuing my undergraduate in psychology. So I just wanted to know more about child psychology as it's very interesting, and also want to pursue it in higher studies. So yeah, that's why I joined this.
Okay. Thank you, Swati, for letting me know and letting everyone know. Okay, yes, next. Who wants to speak up? Otherwise, we'll just start in. Then you'll not get an opportunity to introduce
Can
yourself.
I speak?
Yes, yes, ma'am. Sure.
Can you hear me?
Yes, yes, you're audible.
And my video is also on.
Yes, it's on.
Okay. Good evening, everybody. It's very nice to see a galaxy of psychologists wanting to specialize in so many things. I'm Vidhu Mohan. I'm Dr. Vidhu Mohan, Professor of Psychology from Punjab University. And I'm a trainer also, and I'm a counselor also. And I have trained many counselors. So
Wow.
I am very happy that you started this forum because my experience has been that in many universities they have started diploma in counseling where people don't even know this. And we have to bring some sort of scientific temper in counseling and make it respectable and um, discipline, which can give benefit to people, give help to people, bring positive psychological input
Yes.
to life and adjustment. And so
Absolutely, ma'am. We're all here to learn more from you.
students have become professors, and I just wanted to see what are the youngsters doing. So I'm very happy that many of you have come for all these things. So I thought I'll just join and listen to you. So my best wishes to you. And
Thank you, ma'am.
and try to make psychology very
Please do add in your inputs. It will be great from your experience. And
Hello.
I'm saying it to ma'am and I'm saying to everyone. So if we all, combine, collate our inputs, share our experiences, I think that's how we all will learn from each other. And that's why this webinar has been conducted, just for a platform where we all can interact from each other. So please be participative, and it's not something that I'm going to speak and you're going to listen. I do not like doing those things. I want everyone to interact, speak up, share their own personal experiences that you've been experiencing. I'm sure we're all professionals or parents or counselors or have some sort of an experience with working with children. Yeah, I'm sure we're all from that base. Even if not, we've all seen our cousins, maybe our grandchildren, our children at some point of the time or the other, or maybe our neighbors' children, I would rather say. So you have some sort of an experience. How do children behave and how do children react and what works best for them? Yeah. So we are here to learn from each other. So please do give in your inputs. So now I'll just share my screen. Today's topic is challenging behaviors. Anyone would like to begin with what is challenging behavior? So challenging behavior is a term that has different perceptions, I would rather say, or has different definitions to it. So I just want to know, what is your view on challenging behavior? What does challenging behavior mean to you? It might mean different to me, it might mean different to another person. It may be different for a parent, it may be different for a counselor. Yeah. So
Yes, ma'am. Not be able to cope with the environment.
okay.
Maybe it can be a challenging behavior. Yeah.
Okay.
Like for
Not being able to cope with the environment. Okay. All right. Yes.
Any maladaptive behavior that a person, that a child might, or a person might be
Engaging in.
showing.
Okay. Mm-hmm. Yes.
any behavior that we don't know how to handle it or how
All
to
right.
react to a situation.
Okay, all right. That's true. Okay. Hmm.
Yes, hello.
Basically,
Yes, Daniel, I think you were speaking.
Yes, I was speaking. I wanted to add my voice onto
Yes.
what the rest of the members have stated concerning challenging behavior.
Mm-hmm.
I would wish to maybe use an example.
Yeah,
Uh,
sure.
yeah, yes, an example of a child that you want to put on the child. You want him to put on the shirt, but the child will take the shirt and put on it as a short. So, with that example, I define a challenging behavior as that behavior which causes the parents or the caregivers to scratch their head or to think like, what's wrong with this kid? What's wrong with this child? So that is what I may term as a challenging behavior. Thank you.
Very well explained. Very well explained with the example. Yes, you're absolutely right. Yes. Yes, Pushpa ma'am, you were speaking?
Yeah, there are children which who cannot be controlled in any way. They are overactive, hyperactive. Um, you may call them unruly children. They will not do what you want them to do. Most of the times, their behavior is very funny many times. There are children who will feel happy bullying other children. There are children who will not interact with other people. There are so many types of behavior in children. There are certain children who will not at all mix up with anybody. I've seen, I came across to one child. She was 6, 7 years old, not very much educated, and she couldn't write and she couldn't read also. The parents, they came to me. She was in a habit of touching everything. Anything comes, she will touch. And to my surprise, the behavior was because she could not see properly. I gave her glasses, and there was a dramatic change in her behavior. She stopped because she could not see properly. She would try to touch everything and feel what it is.
Yeah.
It happens many times.
Yes, absolutely. So once you identify what exactly is the antecedent, why is that behavior happening, that makes
Most
a
of the
difference.
times I've seen that there are certain medical problems associated with this kind of behaviors.
Yeah, absolutely.
And we must correct that medical.
Yes. So ruling out the medical aspect is important first, rather than just treating it with the counseling, and behavior modification. Ruling out the medical aspect is essential, definitely. Yes. Anyone else who wants to speak up their definition of
Ma'am,
challenging behaviors?
basically
Yes.
the challenging behavior is like
maybe
Yes.
ADHD and autism problem children's behavior.
Okay. Right.
basically
Devanshi.
challenging behavior is like the when child is unable to cope with the other children or in an environment. Like sometimes the child will be very aggressive, in aggressive mood swings is coming to the child also in some situations. All
Yes.
these things are the challenging for the child.
Okay. Yes, Shruti. Are they challenging for
Um,
the
so,
child or are they challenging for the parents or the caregiver?
what I believe is that it's a very subjective definition, and what might be challenging for one person might not be challenging for the other person. It may also differ culture to culture. So, I don't think it's very much possible to pinpoint a specific definition for challenging behavior.
Absolutely. That's why I told you that there are different perspectives. Everyone, for me, challenging behavior might be something different, but for you, it might be something different. Everyone experiences those challenging behaviors and then learn what might be challenging for you might not be challenging. So the question I asked, was it challenging behavior for the parent or for the child? I think it is for both. Don't you all think it's for both? Maybe the child is trying to communicate something and the child is not able to communicate. So that is challenging for the child. Maybe the child is, the parent is trying to communicate something or maybe set out some rules for the child, which is beneficial for the child, but the child is unable to understand in a long term perspective. So that's challenging for the parent. So I think it's challenging for both the parent, the therapist or the counselor, as well as the child. So it's a challenging way for all the three of them. Yeah. Yes, Daniel, I think you raised your hand.
Yes, I wanted you to clarify a little bit
Hmm.
in regards to the challenging behavior for the on the part of the child, because I was looking at this
I will come to that.
from
I will come to that in my presentation. Don't worry. I'll come
yes,
to that.
yes.
Don't worry. I'll give that clarification. But for right now, my only main concern is to let you know that it's challenging for all three of them. And it's not just challenging for only the parent or the therapist. Only the child is
Okay.
not trying to make a ruckus out of the situation. It's the child
Mm.
also who's suffering. Yeah, maybe he is not able to understand. I'll come to that part during my presentation. Okay, so one announcement that I wanted to make, that please do stay till the end of the seminar, because like the webinar, because the certificate process will be told you towards the end. So I don't want that you all should miss out on that part, because if you're intending, then I think you should be getting the certificates. So that process will be told you then, so please do stay up till the end. Okay, so yes, so we'll be covering today what is challenging behavior, like the way we discussed, ways children may reflect their challenging behaviors at a home setting or a center setting, anywhere they are, possible attributes leading to challenging behavior, some strategies to help overcome challenging behavior, supporting challenging behavior, parents and teachers as partners for support. So, behavior is communication. It's the way children let us know what's happening to them emotionally and psychologically. When a child's behavior is challenging, it's usually serving a purpose for them. It may be a way of letting you know they're anxious or they're scared, or a way of them managing the big emotions we all have: rage, terror, delight, horror, despair, maybe shame at times as well. Some children may show behavior that doesn't match the emotion they are feeling. For example, a child who's raging may in fact be feeling despair. The mix up here will come from the experiences that have not helped them understand their own emotions or response. This is an area that children with autism, especially, may struggle with. They often use autism or social communication disorder. They often use behavior to communicate, and it's important that you recognize how their condition might shape the way they are trying to communicate. Daniel, did I answer your question here? Is it clear? Why is it challenging for children?
Mm. Yes,
Yeah.
I have got it well
Okay.
by yes, I've got it well by what you meant by it being a challenge
Yes.
to on the part of the child as well. But however, I I, I want to look at this notion in a way that there are certain set way of the parents or caregivers how
Mm-hmm.
they respond to the child's anxiety or the child's complaints or the communication which the child is always trying to make, and the parents and the caregivers are not able to pick it. So I was still lost within that process.
Yeah, so a lot of times, yeah, the parents and the caregivers are not able to understand, which is why the child engages in any kind of challenging behavior. Maybe he engages in a self-harm thing, yeah. Maybe he's feeling anxious from within, and maybe he's not feeling too well, but he cannot speak due to uh, maybe very limited speech or language, or maybe due to inability to express. Their expressive language is low. So how do they communicate? Maybe they are communicating by hitting themselves that something is wrong with me, please understand me. Yeah.
Yeah.
And
I get.
also they try and communicate in different ways by maybe there could be a time where that kind of behavior was reinforced by the parent accidentally. Maybe he would have hit it himself and the parent would have been like, oh, aapka sar dard ho raha hai, or maybe are you feeling having a headache, and they would have just pressed his head. So he's learned that kind of behavior. Every time I hit my head, my parent or my caregiver is going to do this to me. Yeah. So that becomes a learned behavior as well at times. Yeah. And it keeps on repeating, and it's a vicious cycle then. Yeah. So that's how even the child is struggling to make the parents or the caregiver understand, and the parents and caregivers are of course struggling to understand the child. Why is that the child is engaging in that particular challenging behavior, which is not appropriate, right? So this is what I meant. Challenging
All right.
behavior, what it looks like. Behavior can be described as challenging when it is of such an intensity, frequency, or duration as to threaten the quality of life or the physical safety of the individual or others, and is likely to lead to responses that are restrictive, aversive, or result in exclusion. Okay, so this is the definition that is given by one of the researchers. But as I told you, the definition varies from an individual to individual, and we've already discussed about different definitions. I hope you've all learned from the different definitions told by. So here is an activity. Let's quickly do it. Write down any one challenging behavior that you've observed, and how did you deal with it? Quickly do that. I'm sure we're all professionals, parents, and we've encountered that. We're all at that level that we can do this activity well. Even if you've not dealt or not done it in the past, just imagine and write it. Quickly do it. How would you handle? If you've not handled, if you've handled, then how did you do that? Okay? Any one challenging behavior. Giving you a minute's time to do this activity. I hope you all have a pen and a paper handy for doing this. And I can see a lot of you have put your videos off. Quickly come back. Otherwise, I feel that I'm talking to just the names. I don't want to do that. I want to talk to people.
Yes. For me, I've ever. Hello.
Yeah, just wait. I'll let you know when to speak up. If you're telling me the answer, just wait. Just write it down quickly. Do this activity.
Yes.
I want
The
everyone to do it.
challenging behavior is rage.
Daniel, just wait. I let everyone complete. I'll let you know when to speak up. Otherwise, others will get the idea, and I don't want to do that. I want everybody to have their own individual challenging behavior experience. Write down about that and how did you deal with that. Is it done? Can you please raise your hands for those who have already written about it? Okay, I can just see 3 or 4 people only. How about others? Others are there or not there, just switched off, switched on and went somewhere. Okay. So I think a lot of you have done it now. Okay. Who wants to go first now in speaking? Daniel, I think you can start. Yeah, because you were already speaking.
Yes, thank you very much, our facilitator. The challenging behavior which I've encountered with my niece was that of rage. Rage. She would express her feelings of rage by throwing things around and also even hitting on the floor, hitting her head on the floor while crying all aloud at at times at me, at times at their own mother. Yes. So I would calm her down, and I would affirm to her that what she had wanted is going to be given to her. So with time, she got used, and she would relate very well if a situation which would previously make her outrageous, she would not anymore throw things or hit her head on the floor. Yes. Thank
Okay.
you.
Okay. Thank you for sharing. Yes.
May I
Next.
go next?
Yes, Shruti.
So I'm currently doing an internship and I deal with children over there from age of 6 to 9. So what I've noticed is that most of them are very stubborn and they just want to do something or they don't want to do something and they'll be very stubborn about it. So I believe we can deal with it by being patient and using the system of brownie points, wherein if they are very stubborn and so they are not listening to you, so you can you take away something of theirs that they like very much, or you can punish them with a very small something punishment, or you can give them brownie points when they do something nice, so like a chocolate or something maybe.
Okay. Thank you for sharing. Yes.
Can I go on?
Yes, Radhika ma'am. Yes.
So this is about a boy who was 11 years old. He was very much aggressive. He was referred to me by his parents. He used to beat his mother, and his mother was unable to manage him. Uh, he used to beat everyone also. He was very aggressive. Whenever he came to the counseling session, he used to throw chairs and throw the objects in the room also. It was very difficult to manage his behavior. So he was also referred to the clinical psychologist later.
Okay.
That was
Okay. So how did you deal with it?
yes. He was able to express his views in the counseling.
Okay.
So first he was aggressive. He used to throw the things. Then he used to calm down a little bit, and he used to come and talk to me for a while.
Okay. That's great.
That was
So
also
you
able
were
to
able
happen.
to, yes, you were able to
Yes.
help and support him. That's great.
Yes. Yes. Yes.
Thank you.
Thank you. Thank you.
Yes, Kishita.
Yeah, you can hear me?
Yes.
Yes. Okay. So since I've been working in the school, it's like I majorly deal with kids below 10 years of age. So we had recently, the school had installed those automatic, tap and the soap. So you just swish your hands and you get that soap. And then there was this child who practically came out with the whole of foam, and the child, uh, so he was full soapy, to put it that way. And then we had kind of got him to, like, as a counselor I was being called, and what we did was, he became the monitor with the housekeeping staff, where he had to help him clean if there is a water spilled outside the bathroom. uh, and of course it was not taken very nicely by the parents, but we had to teach him in some or the other way, right? So instead of punishing and making it a big gaga about it, we kind of made him a monitor, and then the teachers also kind of got involved. But yeah, it was, I think, one of the moment where I can never forget. The child full like a Santa Claus, he came out. So yeah,
must have been pretty much challenging, I'm
yeah,
sure.
extremely. And that is something, one of the ones I'm telling you. But yeah, that child kind of tested my skills.
Didn't something happen with the sanitizers?
Oh, we had one who drank it because he was not
Yeah, I've
so
heard a
yeah,
lot of cases.
yeah, that's happening.
Yeah. Yes. Yes, next. Jinea?
I have a cousin brother who is of 8 years of age, and I have seen that whenever I am asking him to sit down to study, he becomes very unruly and he doesn't listen. And okay, a common thing he does is he crawls under the bed. So what I did was I tried to attach a reinforcement to the idea. I told him that if he sat down and did study for half an hour, then I would give him a chocolate, or if he sat down for an hour, then I would let him play some games. So I tried to like reward him with something once he did something that I wanted him to do and performed accordingly.
Yes. So did that help?
It did. It did help a lot, but then at times he just went like, I don't want to do this. But then out of 10 times it worked, probably 8 times. So I see it as a win-win situation.
Okay. Yes. Next, Mahalakshmi.
Yeah, this is about self-harm behavior of a student in my school. This girl is a teenager. See, whenever she finds any sharp item, when her mood is very low, she would start harming herself. So we had to take away all the sharp items from her. We have to frequently check her bag and all that, inform her parents, and we used to talk to her reinforcingly, like appreciating her, all that, and then we had to refer her to the clinical psychologist for an assessment as well. This is the behavior that I had handled.
Okay. Okay. Thank you for sharing. Yes.
Yeah, hi. So actually, I've now realized that my name is popping up as Hazira. One of my colleague logged into it. My name is Deepthi. Yeah, I have a niece who is 1 year old.
I can rename you. How do you spell that? DEEPTI?
PTHI.
PTHI. Okay. Done.
Yeah.
Lancer के जितने लेके आए हैं Lancer.
Yeah, so I have a niece who is 1 year old, and she shows little passive aggressive behavior, and when she's not given anything, she like yells. So I somehow was waiting for my turn because there's a Bharat happening here. So there's a disturbance. So please excuse me. I'll quickly finish my answer.
Okay, sure.
So I've come across. I used to attend a lot of webinars, and I once read, when the child raises their voice, you rather, instead of doing the same, reflect lowering down your voice. Like I started whispering in her ears, and then she was like quite surprised and taken back, and then she got curious, and that worked sometimes but not always though. Another thing is throwing things. Yeah, again, by attending webinars and seminars, reading about it, I've found this way that you can direct them to give that, and it worked. Whenever she throws me like, hey, can you give me that to my hand, and I would just spread my hand, and she would just pick it up and give it to my hand. So yeah, that mostly worked. And that feels that it will also improve her concentration and give a direction to her action. And yeah, so I'm just learning.
Okay. Thank you. Yes. Anyone else would want to share what they've written?
Can I speak?
Yes, yes, Shivani. Speak up.
Hi. Okay. Am I visible?
Yes.
Okay. So this is about a child I saw some time back under a supervision work. And this child must be around 10 years of age. And he was having certain question and thoughts about kiss, hugs, and even more than that, because again, a lot of children are also exposed.
You're not audible now, Shivani.
Am I audible now?
Yes.
Okay. So whenever he would ask these questions, Mama, what is the case? I feel like kissing this person. The parents would say, बहुत गंदी बातें हैं, वल्गर बातें नहीं करनी, ऐसी बातें सोचनी है. And this kid internalized those things and started shaming himself. And every time he would have these thoughts, he would start feeling a lot of immense amount of guilt and ridicule, and it started showing up as anxiety. So this was a challenge because parents are concerned कि ऐसे thoughts क्यों आ रहे हैं. So they were struggling कि we don't know as parents how should we deal with this. And the kid would not talk about it because there was so much of shame around the topic and thoughts. He wouldn't want to share this with an external person he doesn't even know. So after rapper formation, I'm just saying how I dealt with it. We started talking about it and we normalized that these things are pretty normal after an appropriate age and in an appropriate environment. And these are something every kid goes through. They think about these things, they question these things. We also educated parents that you don't need to guilt or shame the child. You need to say that these are normal thoughts. And eventually the kid stopped having those thoughts, did not have anxiety, and eventually everything worked out. So basically the shame and guilt, that is what we took care of and normalized these questions.
Okay. Thank you for sharing your experience. Yes, anyone else who would want to share, or should we proceed further?
Ma'am, am I audible?
Yes, yes, you're audible.
Yeah. So as I'm a mother of a toddler, so I've seen a lot of tantrums and his adamant behavior for getting something or for eating something. But the most recent one being he was very much into mobile games, because we all also tend to, just try to make them busy using the technology so that we can have a bit of time and we can concentrate on our work. So did I. So but then I regretted, because then he was like constantly asking for games and all, and slowly he started choosing his own games, and he was playing violent games in which shooting people and killing other animals or shooting animals was there. And I started noticing a change of behavior where he started being a bit aggressive than normal, and very desensitized towards other living organisms. Like he'll just see an insect and go and harm it. So because he was not like that, he was very loving child and very very sensitive child. I thought like something is wrong. Then I tried to understand what might be the reason. Then I saw that while he's playing the game, he's very much excited while killing someone or just getting a point after killing something. So I just understood that it might be linked to the game. So I just controlled it and slowly changed it from that. I just logged all that games which have like violence and all. So now he's been bit much, like very much in control. Like now he's not like that. And I try to talk to him, and not in a like adult, like I'm ordering him or I'm just putting everything on him. I'll just talk to him and I'll just try to sensitize a bit towards everything, like because everything has life, and I just tell him everything so that he knows everything. I don't tell him that don't do this or don't do that. Rather than I'll just make him understand why is that being asked from him and why he is asked to behave in such a manner. And yeah, I just reinforce it, not with materialistic things, but with a lot of love and just a lot of saying that you should be proud of yourself doing such things, and I'm very proud and all that. Thank you
That's
so
great.
much.
Thank you for sharing. All right. So I'll just show you a glimpse of a few challenging behaviors that could be here that you would have seen, or hurting others, maybe hair pulling, hitting, head butting, self injury, head banging, eye poking, hand biting. So these are some of the extreme challenging behaviors, maybe spitting, smearing, removing clothes in public, running off, eating inedible things, some destructive behaviors, aggression, self injurious behavior, property destruction, long, full blown tantrums, maybe loud or repetitive noises, running around, etc. Irritating and interfering behaviors like self stimming, repetitive and persuasive speech or actions, social withdrawal, lack of responsiveness, or there is lack of initiation. So, all these are some of the challenging behaviors, and I'm sure you're all aware of that. So some attributes to challenging behavior, there are different, attributes that why is that behavior happening. So there are biophysical factors such as medical conditions or disabilities. As I told you, so we have to rule out the medical conditions. Maybe at times the child lacks a particular skill because of that, because of his disability, he is not able to perform, or like he's not able to do a particular task, then he engages in a challenging behavior, as we discussed right in the beginning. Some psychological factors, maybe some emotional trauma, maybe lack of social skills, behavioral or social factors, including where a student problem has been learned through reinforcement, as I gave you the example that the behavior is learned. Consequences or adaptation to social practice. A student with a learning difficulty repeatedly misbehaves, knowing that he or she will be removed from the class, and this will avoid his or her learning difficulty being exposed. So this is also one of the attribute. Historical community factors, including for students whose family members had difficult, maybe sometimes traumatic experiences of school or government agencies at times. Student group dynamics such as bullying, teasing, cliques, or students' apathy and hostility. Environmental factors such as level of classroom noise or that's disturbing, or classroom seating arrangements. Maybe they are not sitting in their comfort zone area. Maybe they're not liking people around. Maybe their classmates around. So that could also be one of the trigger. Classroom organization issues such as inconsistent routines, inadequate materials, or cultural differences. Teacher behavior, for example, maybe the child is not liking disorganized sessions, maybe some boring lessons that's not of child's interest. Overreaction to misbehavior or over reliance on punishment. So a lot of times, a lot of researchers have shown that challenging behaviors happen because of learned behavior, lack of routine, maybe boredom, health, teaching methods, behavioral difficulties, any particular change in environment, as simple as maybe a child room has been shifted to another room. So that's also a change in environment. So maybe he's not able to find his own thing. Maybe some renovation work is going on at home. So that's also a change for a child. A small change can also be a cause of any particular challenging behavior. So there are physical causes, environmental causes, trauma, communication, learned behavior. So these are some of the common causes. So what lies behind children's behavior? So this is also something wherein I told you that it's challenging for the children as well. So this I have noted it down from one of the research, but there's no proven fact that they are feeling this way. So this could be a possibility that if they are behaving in a distant, disengaged, shut off manner, maybe they are on their survival mode. Maybe if they are behaving in a defiant, angry, or aggressive manner, maybe they are fighting in the survival mode or feeling threatened or afraid. Maybe if they are looking for attention, they needed attention, trying to make a connection. If they are withdrawn, maybe they are fearful or conscious. If they are rude, maybe they are self protective, rejecting before being rejected. If they are not engaging with others, that means not feeling safe yet. If they are engaging in self harm, that's a coping strategy for an emotional pain. So there's no proven fact that these are the ones that they might be feeling, or these are the ones that they are going through. But yes, a lot of researchers show that different things mean different for children. I think we all can experience, and that's how we learn. And every child is different. The more we interact, the more we experience, we get to learn. So with children, we learn the maximum. So the how they behave, how they react, how they do behave in any particular situation, how they do things in differently. So every child is different, so maybe they feel differently as well. So this is something that I really liked, and I just wanted to share that yes, it's challenging for the children as well. So do not forget that being counselors, parents, psychologists, it's not just challenging for you. So this is something that I really, really wanted to reiterate in this session. So some common examples: being asked to do something, then they engage in challenging behavior. Being told you can't have or do something, then there is a full-blown tantrum. I'm sure most of you can relate to this. Maybe exposure to a particular individual or activity, the environment, being bored or being ignored at times. Maybe mom or the counselor or the psychologist is a bit busy or engaged, so then they will come to your face and try to seek your attention. That why is she doing that? Why isn't she like him? Why isn't she looking at me? So, or maybe do something that your attention will directly go towards them. Yeah, is it true? How many of you experience that? Can't see any raise of hand, any thumbs up, no indication. Or are you all there or slept? Quickly unmute and speak up. Do you have some inputs?
Actually, I didn't really get what you said. So, is it possible for you to repeat it? Yeah.
Yeah, who is it? Shruti?
Yes.
So here I'm trying to tell you some common examples that why do they engage in, this challenging behavior. Maybe you've asked the child to do something in particular, then they might just throw tantrum, which maybe they are not interested. Maybe, for example, you've asked them to do 1 page of writing, which is not okay for them. So then they will throw a full-blown tantrum. Yeah. So what is it that if we take ABC data, what is the antecedent right before the behavior? Maybe your directive that happened. Okay, write 1 page. Yeah, so that's a big directive. Yeah, so maybe the child didn't want it to do, so he will throw a tantrum. So being told what you can't have or can't do something, maybe they want something, maybe that's very expensive. As parents, maybe you do not want to give something, or maybe you are his teacher or a counselor and you do not want to give your own personal thing and you deny that no, you can't. Maybe, like, for example, they're asking your personal phone, but you can't do that, right? Being your counselor or a teacher, children do that. That's a very common example. You can't do that, so you will deny it. So once you deny it, once the child has denied access to a preferred item or a particular item, then they definitely engage in a full-blown challenging behavior or a tantrum or whatnot. Yes, Pushpa ma'am, do you want to say something? I think you unmuted and raised your hand. Okay. Exposure to a particular individual or an activity. Maybe the environment is something that's triggering them. Maybe they're not liking, maybe they've gone to some wedding where there are a lot of loud noises and they're not liking that, and they engage in any inappropriate behavior at that point of time. Maybe you do not understand, being in that particular situation, that why is he behaving that way. But yes, it's a change in environment from home to some other party or some wedding. Yeah, there are loud noises outside. He does not likes to engage. Especially, I've seen a lot of cases. Children have been at home during COVID, and now when they've started moving out, so they are not liking so many people being together. A lot of children are throwing tantrums, showing a lot of antisocial behavior at this point of time. They do not like people being around. So I've seen a lot of cases where There's lack of social communication. There's there's the social skills are lacking a lot because there's not been much of exposure to them. Yes, Shagun, do you want to speak up?
Yes, ma'am. The example that I can think of this situation is, the first day when we go to our schools, we cry a lot, we throw tantrums, and at times that parents literally have to come back and pick us up. So I guess this situation changes and everything. So I really think that this over here, this example can be a
Absolutely.
best one.
Even right now, when the children have started moving back to school, they've for initial 1 or 2 weeks, we got so many cases wherein the children denied to go to school. They threw so much of tantrums. They just wanted to sit home, relax, on their sofa and maybe attend online classes. And now they have to get up in the morning, change their entire schedule, do all the activities in school. So, initial 2 weeks were really, really difficult. And even some children are finding it difficult. We get a lot of cases like this, even till now, that, they are having struggle in transitioning. So, the change in environment is there. They are so much used to being at home, doing other classes online, doing their school classes online, doing a lot of activities online. So they're accustomed to that routine. So there is a change in routine which is causing a lot of challenging behavior. Yes, Devanshi, you want to add up?
If you don't mind, I want to add up.
Yes,
So
sure.
when we have chosen a topic or something, our entire focus is on child's behavior. Now that I could see everyone is relating, but I would say, I mean, it's my perception. Like, put yourselves to the same situation. Even we didn't like to get back to the offices. Just that we are socially conditioned and enough mature to deal better. So I would like to first put ourselves in the same shoe and to come down to that extent, that how would we relate to that certain emotion. If I'm called to a school or college after in a period of 5 years or a month, even I would behave the same immaterial of how adult I am. So yeah, so I
Yeah,
want to
that's
just add.
true. We can definitely put ourselves in the same situation, considering the level of understanding is different. So, and the level of maturity is different, which is why we adjusted well to the change and adapted to it. And children are finding a bit tough, but I'm sure most of them have now. So now very few cases are there which the children are finding it difficult, but otherwise most of them have had a successful transition. Yes, Devanshi, I can see your raise of hand. Do you want to speak up or should I move ahead?
Yeah, I want to
Yeah.
speak.
Yeah.
The problem is that when the child is having going to school and having making a new friends, think some childs are having a problem in that they are not in they're not able to be being in a friendship, or all these things are the various like hindrance in their way to develop in their social life,
Yeah.
all these things.
Yes. Yes, Kishita ji, do you want to speak up?
I'm sorry.
Okay. Yes, Devanshi, you are right. Absolutely. So, how do we manage children's challenging behavior? So, this is a question to you all. What do you think could be a possible way to manage? Anyone? Only one thing that you feel can manage, that you can manage everything. That
We
one
can
thing.
use operant conditioning to manage it.
Okay. Any skill that you feel one should have. Forget the strategies, forget the terminology, forget being technical. Okay, here. Very, very basic. One skill that a counselor, a parent, or a psychologist should have.
Communication.
Communication, to interact with the person in a daily basis. This is a very important for a parent, also for a counselor also.
Okay.
Listening skills and patience.
Listening skills. Yes.
I think by
I
being
agree with the second word. That's what something that I was looking for is patience. If you have patience, then you can deal with any challenging behavior. That's the key. So it's not just about being a professional counselor, being a professional child psychologist, being a, you know, being XYZ, whoever we are professionally, or being a parent. If we have patience, we'll be able to be calm ourselves and deal with the situation calmly. Instead of, if we are not patient, if we are not calm, then the child will also rule over us. He will get to know. So, children are very, very smart, let me tell you. They find the smallest of the cues. Maybe they see even they see your eyes and they get it. What kind of reactions do they have? They get reinforced even with your eyes, even with your smile, or even with your lips, or maybe a slightest of your hand movement, they might get reinforced with that. Yeah, that's what my experience has been with children. No matter how much neutrality I practice, uh, they do get it at times. At times, you feel like just laughing it out, but you cannot because the situation is not appropriate. Yeah. So some children are so cute and they are behaving in such an adorable manner, but ultimately they are into a challenging behavior where you have to remain neutral by your face. So that's the key. So I want everyone, before I go ahead with discussing any managing of challenging behavior, as I use the word neutrality, right? So one activity I want every one of you to do. I'm sure you all have smartphones in and around near you. Yeah. I want you all to pick up your phone right now and switch on the camera. Switch on the camera. Giving you a minute's time. Switch on the camera. Not here. I mean, here, of course, it's there if you're joined from the phone. Probably you can switch your tab and switch on your normal phone camera. And I want you to look at it, and make a neutral face that you would make when your child is engaging in any challenging behavior. A neutral face. So for making that neutral face from inside, you have to feel those behaviors that we have discussed, that the child is right now performing in front of you. And you do not want to reinforce or reiterate that behavior. You do not want it to be repeated. So I want you all to click a picture of your neutral face right now. Quickly do that. I'm giving you a minute's time. Done? And now just look at it. Is it neutral? You can delete it. I don't want you to save it. That's just an activity that I wanted you to do. I mean, it's okay even if it's not a nice picture. We're not posting it anywhere. It's for your learning. Is your face neutral? I'm sure you all can speak up. Come on. Is your face neutral when you've clicked the picture? Or you didn't do it?
Yeah, I actually came across the same situation where my niece was doing something, and I wanted to just be neutral, didn't want to react because I know that she's gonna pick it up. I tried it way hard, and then I just walked out because I was feeling like to laugh, and I just walked out silently without reacting. Yeah, I could do it times, but it gets tough at sometimes.
So that's also something that's very, very essential, that we have to maintain neutrality whenever any challenging behavior is happening. Okay? Forget the strategies, forget everything. Once you have patience, once you are neutral, then you're calm, then your mind will be a bit calm. to think about the strategies, to think about what can you do in that particular situation. Okay, so what is the behavior? So while we understand the behavior, we'll come to, how do we manage it? What is that behavior? What is the message the child is giving? Like we discussed, what can be done to help the child? So this is something that we have to think. So once we are patient, once we are calm, we'll be able to think about it. So stop for a minute. Remember this traffic light. Stop, think, and then respond. Remember, please, please, please do not react. Respond to situations. If you respond, then you will be able to help your child. If you react, everything will be gone and you have to start from the very beginning. Yeah. I'm sure some common techniques you all are aware कि हम क्या क्या कर सकते हैं in the challenging behaviors. But these are some things that I felt are very important to reiterate. That's why I'm covering this in the webinar. So some steps: act calm, de-escalate the behavior, acknowledge the feelings the child is facing and feeling. So problem solve what kind of problem he's engaged. Think reflectively. Yeah. So these are some strategies that we can use. Putting space between the child and the other children, maybe a sibling, maybe because of space concerns that's there. Modeling a positive behavior, encouraging, praising, and helping the child, being a calm and reassuring presence without using too many words. Also, one thing that I have observed from my experience, whenever the child is in any challenging behavior, use of more verbal words, use of more, action, verbal cues, or maybe use of more sentences escalates the situation even more. Once you are calm, you are using your non-verbal cues more, the situation automatically de-escalates and comes down to a lower level, because the child is seeing that, oh, my teacher is not giving any reaction to it, so I think it's not working, I must change my strategy. So till the time he's changing the strategy, or something that he's engaging in, you can change the situation. That's what I have observed from my experience. Once I am also not calm, and once I am also using, oh, come, sit down, sit down, sit down, sit down, sit down, the child will not sit down no matter what. The child will, if we say a no for everything, no, 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 you cannot do it. I'm not saying that don't say a no, you cannot have this. Why don't we use alternate words? Why don't we try the other thing? Don't you think it must be interesting? So diverting the child's attention to something else. So that's also one way of changing the situation. Instead of using just no, I'm not saying that don't use the word no. Giving the child enough space that they don't feel physically threatened, but not so much that they feel abandoned. Assess the behavior, focus on its influences, triggers, functions, such as what purpose it serves. This should involve observation and talking with the student and their family. If you are a counselor or a teacher, you should definitely keep the family or the parents, maybe grandparents, or whoever is their guardian in loop, whatever is happening in school or maybe somewhere. So be clear and consistent with the words you are using. Give student different choices, as I told you, that give different options. Maybe how about you use this, how about you use this. Teach coping strategies. What could he do at that very situation when he's feeling very anxious? Maybe a lot of times he's engaging into a self uh, headbutting, or self hitting behavior. How about he can engage in some calming strategy. Maybe there's a net, there's a thera band that is there, maybe they could engage their hands in that, and they do not engage in. So maybe how about ask them to, you know, give a head massage to themselves, that calms them down. Maybe that's because of the sensory overload that's happening, so you do not know what's exactly happening to them, so you have to figure out what exactly. So always note down what happens right before the behavior, what's happening in the behavior, and what is the consequence of that behavior. Then make the strategies. Then only decide what actions to do. Teach them social skills, build a strong relationship, plan for their triggers, conference privately, talk to them as much as you talk to them, but do not talk to them about their behavior right after they've engaged in the behavior. That will not work. That will only reinforce the behavior and they will do it again. So, some verbal intervention tips and techniques, do's and don'ts. Stay calm, but do not overreact. Be supportive, don't threaten. Be monitor paraverbal, don't be judgmental. Give choices and consequences. Do not use sarcasm. Avoid power struggle. Don't invade personal space. Redirect. Don't make false promises that you can't fulfill. Do listen. Do not give too many choices that the child gets confused. Be aware of the proxemics or the kinesics. Then parents and teachers support in managing behavior effectively. As I told you, that do keep parents, teachers, counselors, everyone in the loop, and be consistent. What strategies you are maybe following in school or maybe you're following in the center should be conveyed to the parents, and those are the same strategies should be followed at home also. A home program should also be followed so that there is a consistency at home as well as in school. Yeah, so that the child knows if there is a no for one thing, that's a no in school, that's a no at home. So it should not be like it's given at home but not in school. So then the child will take you for a ride, right? So we have to, there are different boundaries that we have to maintain. I understand the setting is completely different, and it's a group setting, maybe at school or maybe at a center if there's social, there's a group setting. But yes, it is possible. Some rules that we can make, some boundaries that we can make, and we all are on the same page. That's something that's very, very important. The key to learning any new behavior is consistency. Keep reinforcing positive behaviors and adjusting to the negative behaviors. So, thank you very much for being patient and listening throughout, and for all your valuable inputs. And it was a great learning experience for me. Thank you so much. Sir, would you want to start?
Yes, definitely. Thank you so much, ma'am, for the insight on child psychology and the behavior, the challenging behavior that we all are facing from so many, a long time, and the stubbornness and the demanding nature of the children's. So definitely, child psychology can help those people who are facing this kind of issue, and people also who want to build their career in this field, in the growing field of psychology, can learn about child psychology, because these are the basics. Because once a child learn about how to deal with this kind of issues, if they are also aware, if we guide them in a right path, so definitely once they are come in our age, they will not face any kind of challenges. Less challenges will be there. So I welcome everyone. So for this child psychology program, so we have a dedicated program which is of 1 month, and we'll be conducting by Sonali ma'am only. She's a counseling psychologist, RCI licensed, and working with children's from long time. And people who are interested can drop their names on the chat box so we can contact them. So this is a particularly a certification program on child psychology, wherein you can learn about what is the development psychology, major childhood disorders, and behavior observation, and role of a child psychologist in the field of mental health. So I request everyone to join this beautiful program with us and start your journey with us, and definitely you'll be learning good here. We'll try to give our best. So thank you from my side, and also I'm sending you the process how to get the certificate for this, and to know more about this child psychology program. So you can also fill this Google form over there. So thank you so much. And this is the Radhika ma'am. Yes, thank you so much. Radhika ma'am, I think you have already enrolled for the child psychology program.
Yes, yes, sir.
Thank you so
Yes,
much.
I already. Yeah.
So please fill up this form to get a call back and for the certificate, so that we can give you more info about child psychology and the program. Anything else if anyone want to know? Ma'am, you want to share something, Sonali ma'am, about the program?
So yes, it will be an in-depth study about child psychology, and this was just a glimpse that we discussed. That was technically, just to have an insight about what kind of behaviors looks like, and this was a more generic thing. So the program will be having a proper module. We'll be learning different things. You'll be getting assignments. You'll be getting the presentation, and we'll be doing different case studies. We'll be doing role play, so it will be a more of a practical learning experience. Here this was a number wherein this was just a webinar, so we couldn't, not everyone could speak up, but there you'll get a chance to speak up, to perform, to act, to do different fun activities. And trust me on that, I do not take boring sessions. I hope you all enjoyed today also. Thank you so much. That's it. That's all that I wanted to say. All right. Bye bye. Good night. Have a
Good
good
night.
time
Good
and
night.
do
Thank you.
enroll for the
Thank you.
session.
Thank you.
All
Thank
right.
you so
Very
much. It
Thank
was
you.
very informative.
Thank you.
Thank you so much.